the Joho's administration have gone ahead and advertised their positions. This means that they feel that they have been the county government has gone behind the ongoing talks. Remember yesterday, the Kenya Medical Association issued a press statement asking the doctors to go back to work, maintaining that the doctors who will go back to work will not face any disciplinary action. Despite that, the doctors until now, they're saying that no one has been called back to go to work, and of course vowing from Monday now the doctors from the private sector will join in and rally behind their colleagues here in Mombasa. If this will happen, Gladys, then definitely we're expecting to see a total paralysis of health services here in Mombasa. Remember, this is a very critical time that the county really needs the healthcare providers, workers here. This is a time that the county is grappling with the coronavirus pandemic. So if the doctors make good their threat, then definitely we are expecting to see a total paralysis that will force the residents of Mombasa to seek these critical services in other neighboring counties. And of course also the Secretary General Chibanzi Mwachonda saying that if this continues without the county coming on the table to discuss some of these issues and concerns raised by the doctors, then the next move that they'll take is to convince the doctors from not only the coast region but the entire country to join in and of course advocate for these issues that doctors are raising. We were there and just listening to what some of the doctors had to say.
So the consultative forum went well, and the resolutions of the doctors, the private sector shall be mobilized if this matter is not put to an end starting Monday to join into the strike that has been going. So it will be both the public sector and the private sector starting Monday, because we have realized that probably there is still a lot of discontent from our members based on what deliberations have been happening.
I do want to concur that as doctors, both in public and private sector, this is affecting all of us, and we are in this as one family. We do believe that sense will come in, and that as we've heard so far that issues are being resolved and the discussion on the table, that will go ahead and sort us for us out. So as a family KMA, we do want to appreciate that the KMPDU and the other associations have been able to come here to help us address this concern as coast division.
Kama serikali za county hazitachukulia masala ambayo tumeweka kwenye meza na masala ambayo tumekubaliana, basi mjue kwamba wiki ijayo, kama haya maneno yataendelea yanavyoendelea, hii nchi nzima tutazunguka kama muungano wa madaktari, na madaktari wote wa sekta ya umma na kibinafsi watasimama na madaktari wote katika nchi hii. Kwa hiyo tunataka suluhisho ya swala hili la migomo katika nchi yetu, na kusema pia kwamba Mombasa, the promotions must be implemented as per that return to work formula. The doctors must be reinstated, na hiyo ni sauti ya madaktari wote mnaowaona hapa. Those are the bare minimums that will get those doctors back to work.
Doctors in Mombasa took the industrial action in 2nd of December 2020 after the return to work formula deal failed. But again, they are hoping that the county government officials from the Department of Health and the administration of Governor Joho will come on the table to try and highlight some of these concerns. And definitely, Gladys, we're here to monitor the situation. Remember this, if they happen to really down their tools, especially their counterparts from the private sector, then we're expecting to see a total paralysis of the health services delivery here in Mombasa. So we'll be preparing a very comprehensive story on this particular issue, and don't stay tuned and don't miss the story both in 7 and 9 p.m. bulletin.